Is it safe to do both eyes on the same day? Yes. That's almost exclusively what RLE surgeons do, such as myself. We do LASIK surgery, both eyes on the same day. We do ICL surgery, both eyes on the same day. And we do RLE surgery, both eyes on the same day. We even do cataract surgery, both eyes on the same day. And the data out there, so I'll go back and tell you about the history of how this came by. So Kaiser, because they're their own insurer, and they just want to optimize and be efficient, they decided that they were gonna try to do both eyes on the same day and see how that goes. And of course, it was a huge success. There's like almost no infections. There's patients are happy because they don't have to wait a month in between the two eyes. Everything's great. The surgeons are happy because it's efficient. They get to help more people. So that happened, I think, back in 2010 or so. But Kaiser is a unique entity because they're their own insurer. Well, not often I don't know of any other examples of such cases where the doctors and the company are one entity. Usually the doctor requests reimbursement from a payer, such as your insurance company or Medicare. And obviously, there's limited resources, and I think a lot of times, policies can be slow to change, and so there's definitely, from a business standpoint, I can see an incentive to just do one eye at a time. Well, if your vision's good after you do this one eye, maybe you'll, decide not to do the other eye, or maybe something will have happened in that month or so where you kind of back out of doing the other eye. But they typically will tell you that the reason is because of a safety, right? Cross-contaminating and causing infections in both eyes. But if you look at how many times that has ever happened that both eyes were infected after surgery, those are very case reportable. I mean, in the entire medical literature in the world, there's very few of those cases. Anyways, so with the office-based surgical center and the ASC, the ambulatory surgical center, many times we can do both eyes. These are centers that are usually optimized to doing one type of surgery, like they're specialized in doing eye surgery, which means that people in these centers know what they're doing. This is all they do. They're not doing colonoscopies in between eye surgeries. The centers are very clean. These are healthy patients coming through, just getting eye surgery done. So I think for those reasons, now we shift into COVID era where we wanted to minimize the amount of visits the patient had to our clinics, to our hospitals, because of we didn't want to spread COVID. Well, that's when bilateral surgeries became more popular, and suddenly we're seeing, well, this is even safer than doing one eye at a time. Again, we don't know why, but the data suggests that it is safer. And now you see all these European countries and countries all over the world. I'll give you an example. I think in England, the National Health Services almost switched almost exclusively to doing both eyes on the same day. And a lot of Scandinavian countries had started to do that roughly around the time of COVID. And so in America, we're sort of seeing eye surgery as just so darn safe that we're doing both eyes on the same day now. And a lot of folks who do premium lenses see that there's really no cost difference between doing insurance and then having to pay the extra $5,000 per eye versus just doing roughly about the same $6,000 or so per eye and get both done on the same day. So yes, long story short, it's very safe. I think if you go to my website, I'll have 20 articles about the bilateral sequential same-day surgery procedure as being the same amount of safety, if not safer, than delayed sequential cataract surgery, which means doing one eye one day and doing the other eye on a separate day. So don't be scared. It's going to be very safe. The chance of infection is extraordinarily low, particularly in a center that just does eye surgery, and follows every sterility protocol. Hope that helps.